Okay, sharing screen. All right, a quick pass through reproductive choices so that you get an idea of some of the important parts or points on the slides. Once again, I encourage you to look through it and get the statistics and some of the other things. Make sure that you've got a good foundation of what's going on here and some of the definitions in there as well. So, talked about love. We talked about relationships and forming families. So now we're going to talk about reproductive choices. Um, just as a definition, when we look at conception, we're looking at fertilization of an ovum to a sperm. So for those of you who've taken a biology class, it's going to be pretty familiar to you. So those who haven't, basically the need for conception, you need to have an egg from the female. Females are born with the number of eggs that they're going to have in their lifetime. You need viable sperm, and males develop sperm continuously throughout their adult lives. And then, of course, access to the sperm. Now, we're going to talk about different modes. There's, of course, the natural where you have intercourse, but then, of course, there's in vitro and other ways that either sperm, eggs, or both are harvested, and then conception occurs outside of the female, and then the eggs are implanted. So we'll go over that as well. But basically, you need access from the egg to the sperm, no matter how you want to get that access to happen. So when we talk about conception, we need to talk about contraception, and there are basically 4 types, and here they're listed. So make sure that you look at each one of these. We'll go through how these are applied here in the next few slides. So make sure you're looking at those and know that there are 4 different types. When we talk about contraception, we're talking about different rates of pregnancy. And so we can have a perfect failure rate where you have a pregnancy occurs even though you used contraception perfectly. So let's say you're using the pill, for example, and you've taken it just every day, you haven't missed a day no matter what, and you still get pregnant. That's a perfect failure rate. Typical use failure rate is the number of pregnancies when you don't use it correctly. So same example, let's say you're on the pill and you're taking one, then you forgot if you, maybe you remember if you did, or if you didn't, you couldn't remember, you take another one or you didn't. So if there's a little confusion or you don't use it correctly, that's typical failure rate. So that's the number of pregnancies that are going to happen if you make mistakes with your contraception. Understand these 2. That's why I kind of spend a little more time here. That's important to understand. And each form of contraception has a perfect failure and typical failure rate. When we look at contraception, the other reason we use it is to prevent the spread of disease and infection or virus. And one of the more serious ones is HIV. Now, HIV is the virus, and AIDS is the late stage of what an HIV infection can cause. So understand that HIV is the actual virus. AIDS is the symptom or what occurs if HIV gets too aggressive in the body. Most commonly, HIV is spread through unprotected sex. Therefore, it's on this slide bank. It's if you look at the World Health Organization and others, one of their main focus is HIV and AIDS, and just educating people on condom and prophylactic use is huge. And there's a lot of money being spent not only to put people out to educate, but to give away free condoms and showing people how they're used and used correctly, so that we have a perfect failure rate if we're going to have it, and to prevent this disease. So anyway, know the difference between those 2. Once again, here's an informatic that just kind of shows you once again, so that you get a little clearer picture that HIV is the virus, AIDS is late stage of that infection. So here are some illustrations of the different types of contraception that can be used. Some of these may be familiar to you and some may not. We'll go through a few of these, but not all of them. So this slide will give you an idea that there are many options out there. Each one has a greater or lesser effective rate. especially when it comes to the prevention of passing on disease or viruses. Of course, condoms, female condoms, anything that has a barrier method is going to be better for that. So your most common, we'll start with hormonal method, right? So the most common is the pill, and it's usually taken on a 28-day cycle. Um, there are placebo pills, and then in series there will be estrogen and then progesterone pills. So most of the pills that you're taking during when you're on the pill are just placebo. They don't really have an effect at all. And then at the time of ovulation, just before that, you'll begin estrogen, and then at the very end of that series, then you'll begin progesterone for a couple of pills, so that prevents the growth if conception does occur. So it's twofold with the pill. Certainly, there are a lot of advantages, and the pill is used for not only birth control but to level out hormonal levels a little bit um, um, in the female menstrual cycle, and so sometimes a young lady might be abstinent and isn't practicing and is not having sex, but they're on it because once they're either on Accutane or some other medication that requires them to be on the pill, or they're just trying to level out their hormonal surges during the month. So barrier method is another method, and the male condom is the most common here. Um, um, the advantages to this is that not only what usually occurs here is that you have the barrier method, but it also has a spermicide within it as well. So the spermicide will kill the sperm, and the barrier method will prevent it from accessing into the female. So the advantages here is that it not only protects against disease, but it also is going to be the barrier method to sperm entering. So there you go. The disadvantages are they're not typically used correctly. There's a pause in the action, if you will, and so a lot of times it's not used, and they can break or leak. So and they're latex, so there could be a latex allergy there as well. Surgical method. Let me go back. There is a female version of this, and if you look on that slide, a couple of slides back, you can see that it is. So there is a female version. It's not used very often. Surgical method. There's a few ways that this can happen with females. You can do tubal ligation, where the uterine tubes are cut off from the uterus so that the egg can no longer flow into the uterus and cannot therefore there can be no fertilization, and there's nowhere for it to go. So the other tubal ligation can also be your tubes are tied, although they're not necessarily tied. They're usually cut and cauterized. You can also do a hysterectomy, where you remove the uterus completely. So and when they do that, typically they will remove the uterus and or with the ovaries. So just depends on what the situation is. Typically, the hysterectomy isn't done unless it's in a severe case. There's something wrong. It's diseased in some sense. For males, there's a thing called a vasectomy, where the vas deferens is surgically cut and then cauterized so that sperm cannot enter into the urethra and then be ejaculated. So that's the vasectomy. Vasectomies can be reversed. It's expensive, but it can be reversed. So other methods, there's something called a rhythm, or the fertility awareness method. Basically, you go on a calendar and you just time. One of the ways you can do it is a calendar method, where you time or you chart the menstrual cycle. Or you can do a temperature method, where you can take your temperature and you'll spike in your temperature. You have to do this right away in the first thing in the morning, where you're in bed, and before you get up and move around. And if there's a spike in your temperature, you might be ovulating. So there's other ways to do it. Anyway, these aren't great, and there's a high risk, right, of a typical failure rate here. So just be aware of that. Emergency contraception. These pills are available at most pharmacies. Typically, you don't need parental or a doctor's prescription, believe it or not, in some states. We have some of the health clinics around here hand these out as well, but it has to be used within the first 72 hours. The closer you have to conception or the intercourse, the better. So if you wait a full 3 days, then you're probably, you're increasing your chance of the pill not working. So so sooner rather than later with this one. Abortion is another one. It's not necessarily contraception because you've already conceived. This is a way to end pregnancy. If you read through there's a couple of ways to do it, and they become more severe or more evasive the further you go. So any of these types of things, anything well within or past 72 hours or days or weeks, I guess is a better way to put that, then you need to travel, at least from our little valley here near Safford Thatcher, you'll need to go to Tucson. We don't have we don't have a clinic that does this, and so you need to, typically you go to Tucson for this. There's a couple of pills mentioned there and a site that you can look it up. Those are just a couple of the early term abortion pills that are used. And then once again, the further you get into the pregnancy, the more difficult this becomes. There's more fetal development, and it requires more evasive action from the doctor to abort the pregnancy. And once again, this isn't just to abort just because you don't want the child. Also is because of danger to the mom. The child is poorly formed and isn't going to survive very many days from pregnancy. So there's lots of other reasons that abortions take place. Just to add in at this point, I think we need to be more aware and kind to people who decide to get an abortion for whatever reason. It's going to be really difficult on them regardless. And I know that there's a lot of political and religious zeal, I guess, at this point before abortion. But I think just as a side note, I think just regardless of your feelings, I think just being kind is a good way to go. Certainly with planning pregnancy, these steps need to be taken. It really is important. I like to tell the classes that sexual activity probably should not be considered a recreational sport. The consequences of becoming pregnant when you're not expecting it can be very severe and harsh on a family, on a person, on their lifestyle, on their goals in life. So it really is important to plan if you're gonna that pregnancy is planned just for the health and well-being of mom and the child, and their all the other reasons that go along with that, social and economic and everything else. So it is required. Babies are expensive. Having them is expensive. There's a lot to consider. Certainly it's traumatizing on moms, and so that you should have a backup plan. And back where I'm from in New York, we had you had a godfather, had a family that was going to take care of your child if something should happen to you. I think we do that out here as well, and that should be part of something that you plan for. You can develop something called a living will that talks about those things and plans for it, and it can be legal. So it's probably pretty important thing to do. Prenatal visits are really important. So when you determine that you're pregnant, make sure you see a doctor. They'll have different exams that they can do to make sure that everything is going well. They'll check protein contents. They'll check the size of the child throughout the pregnancy to make sure there's good growth rates. They'll make sure that the child is in a good position in the uterus, so there's no complications with delivery. All kinds of things that prenatal checks will do that are really, really important. Make sure that you're on a nutrition plan so that you're getting especially like folic acid and things like that to make sure that the child is growing properly. Different types of practitioners. In my experience with our children, my wife for the first 3 pregnancies saw a family practitioner that they were experienced in delivering children. And then the last child, she actually saw an OBGYN, and that was a great experience too. So lots of different options. We actually have midwives here in the Gila Valley, and they do a great job. They work along with our our OBGYN, and they, if there's no complications with the pregnancy, they'll often deliver the child as well. Like I mentioned before, proper nutrition and exercise. The general rule with exercise is if you did it before you were pregnant, you're okay to continue it. Make sure it's okay with your doc. It's not a good time to start a jogging regime or jumping on the trampoline or, things like that when you're pregnant. But if that's something you were doing prior to your pregnancy and your doc says it's okay, then it's okay to continue. So just know that you're going to gain weight. That's a natural thing, and it should happen. You're going to gain anywhere between 25 and 35 pounds. So, but that goes away fairly quickly. A lot of that is water weight, and of course, the size of the child. And then, of course, it does take some effort and some work to get back into pre-pregnancy shape, but it's totally doable, and I would imagine worth the effort. So when we talk about things that can affect the child, one of the main ones is fetal alcohol syndrome. It's the most preventable birth defect caused by alcohol consumption. So don't consume alcohol if you're planning on getting pregnant, or if you are. There's been some stuff out there that says a glass of wine is okay, and the American Medical Association just jumped all over that study. It was a really poorly done study. It was done with just a few people, women. There was, the alcohol content of the wine wasn't checked. What constitutes a glass? Is it 1 cup? Is it a cup and a half? All kinds of problems with that study. So don't drink, just don't drink at all, and don't smoke, and don't do drugs. And you can see there some of the effects if you do. Also, radiation can harm the child. Radiation can harm the eggs and the sperm as well. So make sure that if you're going to get an X-ray, and every time I've ever had one, they don't forget. They always put a lead blanket or a lead covering over the genitalia so that you don't damage eggs or sperm. So X-rays, don't damage that. It's considered a high-risk pregnancy over the age of 35, although more people are getting married later in life and having children later, so we have more high-risk pregnancies than ever. And all that means is that they're going to have greater care for the mom and the child as things progress in the pregnancy. And there's a small increased risk of Down syndrome with maternal age, so be aware of that. Once again, we'll go through this. You can go through it as well. It's just the steps, the way they go through there. So the idea with pregnancy is we're going to get fertilization with a sperm to an egg. Typically, once that happens, there's a hormonal change in the mom, and it can be detected through a pregnancy test and through the urine stream. And then, of course, you can go to the doctor and they can confirm that. So it's divided typically into 3 trimesters, although if you consider the last period to when baby is born is typically 40 weeks. So, but once conception has occurred, right, the baby is then conceived at the end of that menstrual cycle, this next menstrual cycle. So that's why everybody kind of goes trimesters, 36 weeks, but it's a 40-week plan basically. And then you can see there through the trimesters what's happening. And once again, as the child gets bigger, there's a greater need for carbohydrates and proteins and vitamins and minerals and good nutrition. So as that progresses, some tests that they can do, they can look at the fluid and check for issues. They call that an amniocentesis. They can do an ultrasound, which is really, really common. They're doing the ultrasound to make sure that the size of the child is growing is progressing at a rate. At about 15 weeks, they can check for the biological sex of the child as well. If there's something that comes out in the fluid, they can actually take a sample from the fetal sac and look at what's going on there as far as protein development and see if there's something going on. So there's lots of ways to monitor the child and the health of the child. So, and they do that. Birthing locations, as you read there, you just about anywhere, but most common is in hospitals. There are different types, of course, of pain control with having babies, including non-pain. So people will use breathing techniques commonly known as Lamaze to help control that. So it is a painful experience, I'm told. And it's nice that they have pain medications to help. So here's the birthing process. Basically, what happens first is contractions begin. Either the amniotic sac breaks, and so we call it as you've broken your water, basically. Although that may not occur naturally, sometimes the doc has to begin that process, and they'll break the amniotic sac to begin that. If what needs to occur is that the cervix at the opening of the uterus needs to thin out and get larger. So as you wanted about 10 centimeters of an opening, and the thickness needs to be really, really thin so that the baby can pass through. And so that you'll often hear the docs or the nurses describe how effaced the cervix is and what diameter it's at. So they may say something like 3 centimeters or 3 millimeters and partially effaced, or something like that. Centimeters, 3 millimeters and partially effaced. So they'll describe it. So if you look down on the picture here on the right, if you look where the baby's head is, this right here is the cervix. So you can see how thick it is. And so that's the thickness. And then this one is not open at all. So it's 0. So it needs to open up in order for the baby to pass through. Then of course, then there's the expulsion stage where the baby is beginning to pass through, and that requires pushing off and on, timed with the contractions. And then of course, once the baby is born, that you need to deliver the placenta, so that occurs as well. And that is not nearly as painful, but I'm told that the contractions still are quite forceful, and it still is, hurts a bit. So some complications with labor and during the pregnancy. Preeclampsia is one of them. Typically, it's indicated by high protein content in the urine and high blood pressure. Basically, you don't want high blood pressure. That's not good for baby or for mom. So they put people on bed rest for that. A lot of times, if the child's too big or in the wrong position, they'll do a cesarean section to remove the child. And that takes a little longer to recover from because they're cutting through muscle. But there are some, but there's less complications in other places. So typically, if the baby is breech and they can't turn them, so their bottom is facing the birth canal, not their heads, or if they're turned the opposite direction and they're facing the wrong way, they can't turn them. Or if placenta previa occurs, where the placenta is developed down low in the birth canal or the bottom of the uterus, and the baby can't slide past it, so they'll have to take a cesarean. Miscarriages and stillbirths and sudden infant death are all fairly common. Stillbirth especially, it says no direct reason, but if you're a heavy smoker or if you're using drugs, you increase your chance of stillbirth. So if you look at postpartum, this is after the baby's born, typically the first month and a half or so. Baby requires a lot of attention, and something called baby blues or mild depression can occur. It occurs in 70 to 80% of new moms, and it's periods of sadness, anxiety, irritability, impatience, fatigue. You can go on and on. And those moments last a few minutes, sometimes a few hours every day. And it usually goes on for a couple of weeks, and then it lessens and then eventually disappears as those weeks progress, because you gain a little bit more strength. You get into a kind of a rhythm with the child and a routine, and so it gets a little bit better. It's recommended that infants should be breastfed for at least 6 months. There's some advantages to that, as you can read there, and ideally up to 12. So breastfeeding is a good idea. I know it's not super convenient, so they have pretty good infant formula now. But really, according to American Academy of Pediatrics, breastfeeding is the best way to go. Lots of ways the women can be infertile. If you wait too long, if the older you get, the less likely it is to get pregnant, although it still can happen. Endometriosis and pelvic inflammatory diseases are a couple of the other things. Anytime you have an inflammation issue, whether it's at the ovary or within the uterus, it lessens the chance for conception as well. So pretty important to remember. And those things, once again, proper nutrition, good rest, good control of stress, don't take drugs, don't drink alcohol, get regular checkups, all of those things help prevent these kinds of things. Although they do sometimes just occur, and a good doc will help you work through those issues. Men, you can contribute to infertility as well. Low sperm count is the biggest problem with that, and that can occur from either varicose veins or in one or both the testicles. And so understanding that increased heat or temperature differences will decrease the viability of the sperm. You'll still create them, they just won't swim well. So wearing tight clothing, which will keep your testicles up towards your body more and increase the heat at the testicles, will once again damage the ability of the sperm to move well. Drug use, including marijuana, does the same thing. And putting anything warm on your lap. So like if you're using a laptop and you're literally putting it on your lap, probably not a good practice. It's not radioactive or electrochemical or any magnetism or anything. It really is just about the heat. So making sure that you do those things, especially if you're trying to get someone pregnant, then doing those things probably not a great idea. They get tested for infertility, and there's lots of ways for them to test that, and there's lots of ways to make sure that couples can have kids even though they may not get pregnant through normal intercourse. And they work fine. You have to pay for them. When you see a doctor and you have in vitro fertilization or the intracytoplasmic injections or any of those ways, they cost you. So obviously the natural way is the cheapest way to go, but there are options out there, including adoption and surrogate motherhood. I actually worked when I was in the PT clinic, worked on a mom who had three, and she went on to have a couple more babies for other people, mostly family members. She just had easy pregnancies and didn't mind being pregnant. And so after her 3 kids, she decided to go ahead and do surrogate motherhood for others. And so there's options out there, and including adoption. So biological sex occurs at conception, and it's based on your chromosome composition. It can be determined at about 8 weeks of fetal life. You can get a good look at it on a sonogram after about 15 weeks. The father determines whether the baby is male or female, because the dad carries an X and a Y chromosome. So when a sperm is developed, the DNA splits and you have RNA, and that RNA on one side might have the X chromosome and the RNA on the other side will then have the Y chromosome. They're put into 2 different sperms. So one's carrying X, one's carrying Y, and away you go. So it just depends on which one gets there quicker. There have been studies on this, believe it or not, and they're not great, but they both swim about the same. I've read studies that say that X carrying chromosomes swim longer, Y chromosomes swim faster. So it just depends. I'm not sure how true that is, but it's always interesting to read something like that. And I guess it's true. I guess the point is how often that occurs. I don't know, but I suppose there's an advantage about half the time, right? You either outswim it or swim faster because we have the population split right down the middle. So understand that biological sex determined by the dad. and that begins to develop about 8 weeks into development. We then have sexual gender. So we have biological sex determined at conception, depending on what sperm gets to mom, X or Y. Gender is then the practice of behaving either masculine or feminine. This occurs obviously after the child is born, when they start to exhibit behaviors. So from that, we get a gender identity, either a gender role or transsexuality, where there's a conflict. If they feel like they're male and they have female parts, then there's that conflict between gender identity and physical sex. And then the next one, we have a sexual orientation, and that refers to the person's enduring, and that's kind of the important part here that I think we miss on sexual orientation. Enduring means long term, so they're long term romantic or sexual affection towards other whoever, right? Whether it's the opposite or same sex. So the slides on the side, or the picture on the side, just shows a number of different, not all, but a number of different scenarios that can occur with that. So understand that biological, gender, and sexual orientation, we tend to intermix those. They're really three separate things. And so understand that they're what those are. Okay. There we go. If you guys have any questions, once again, text or email me. And I appreciate you taking the time to watch this and take the class.